I'm a double board certified plastic surgeon, and what does that mean? That means that I went to medical school, and after that I went into general surgery residency. I completed general surgery, and what's that? That's removing appendix, gallbladders, all of that, learning how to take care of a patient, learning how to take care of wounds, all of those things that you learn as a basic foundation of surgery. After that, I went into plastic and reconstructive surgery residency. There, the focus was only on plastic surgery and reconstructive surgery. I did that fellowship at Emory University. And then after that fellowship, I did one more year of specialty fellowship with a Dr. John McCraw in breast and body contouring, where I spent a year focused on body contouring for people who had lost a significant amount of weight, either through gastric bypass surgery or weight loss on their own. After that, I came and opened my practice in Guilford, Connecticut. I was double board certified. That means that I took the exam, both the written and oral exam for general surgery, and passed that. And then after I did that, I took and passed the licensing board exam for plastic and reconstructive surgery. That exam is a pretty rigorous exam. It consists of a written exam, and after you pass that exam, you are permitted to take the oral portion of the exam. So the licensing board makes you collect your cases for an entire year of your practice, and they examine what you've been doing to make sure that your judgment is sound, that your results are in keeping with the standard of care that's expected among American plastic surgeons. Following that, you present 5 of the hundreds of cases you've done throughout the year, and we all fly out to Phoenix, Arizona, and we have 2 days of oral board examinations. That includes unknown exam questions where they have scenarios that they ask you how you would approach a patient, and that goes on for 1 day. And then the second day, they take all of your cases that you've presented to them, and they ask you your rationale, why you went through, how you treated this patient, if you had a complication, why that happened, and how you managed the complication. And after that, the board gets together on all the examinees, and you either pass or you don't pass your licensing exam. So that's what you're getting in a board-certified physician. In response to a push in the 90s to make the public aware of who is safe to go to as a plastic surgeon and who you should be a little bit wary of, they were urging patients to make sure that they acknowledged that their surgeon was board certified by the American Board of Specialties. In response, some people who were not certified came up with boards that did not have the same rigorous evaluation system. Boards like the cosmetic board and things like that are not licensing boards by the American societies of medical practitioners. These are just paid for boards. A person does not have to go through the training that I went through, does not have to go through the examination process. So that's how you really vet out a plastic surgeon. Somebody who's gone through the adequate training, has gotten the experience, and then has been vetted by a board of their peers to make sure that they are not only adequate but will excel in the practice. And then in addition to that, I have been in practice for 12 years. I've built up a successful practice in Guilford, and now I'm about to open a second practice in Mystic, where I'll be splitting my time between the 2 places. And I'm looking forward to getting that going in the fall.